It is very nice to greet you again. In today's video we will talk about the following. Dog wound care. Everything you need to know. Accidents happen. Whether it's a small scratch or a large laceration, understanding the basics of dog wound care and knowing when to seek help will help minimize stress, reduce the risk of infection, and speed healing. That small cut on your dog's paw may not seem serious, but if left untreated or treated improperly, it can quickly become a bigger problem, especially if bacteria enters the wound. Emergency first aid for dog wounds. You may need to administer emergency first aid before your dog receives appropriate professional care. This could occur during transport of your dog to the veterinary clinic or if treatment is delayed because you are in a remote area. Wear disposable gloves, if possible. This reduces the risk of spreading contaminants and infection. Use a muzzle, if possible. Even the calmest dog can react unpredictably when in pain. Apply pressure to actively bleeding wounds. Do this until the bleeding stops or, in the case of serious open wounds, until you reach the veterinary hospital. Apply pressure for at least 3 minutes before checking if the bleeding has stopped to allow clotting. Elevate bleeding wounds. Raising the affected area above the level of your dog's heart can help slow the bleeding. Clean the wound. If you can't get to a veterinarian immediately and the bleeding has stopped, this helps reduce the risk of infection. Wounds can be rinsed with warm water and then cleaned with a dilute povidone iodine or chlorhexidine solution. When is home care appropriate? Minor cuts or scrapes can usually be treated at home if they are superficial, not bleeding heavily, and your dog is behaving normally. When assessing your dog's wounds, if they exhibit any of the following symptoms, it is advisable to seek veterinary assistance. Full-thickness lacerations. Wounds that are actively bleeding, even after applying pressure for a few minutes. Wounds near or over the eye. Puncture wounds, especially if they are in the chest or abdominal cavity. Bite wounds. Burns. Wounds containing foreign objects. Wounds that cause lameness or other signs of significant pain or discomfort. Wounds that are red, hot, swollen, foul-smelling, or produce pus or other discharge. Here are some general tips for home wound care for dogs. Cleaning the wound and surrounding area daily helps reduce the risk of infection. Use dilute chlorhexidine or povidone iodine. Although they are available over the counter, it is essential to dilute them properly, as they can delay wound healing. A saline solution is a gentle and effective option for daily cleaning. You can use salt water diluted in 2 cups of water with 1 teaspoon of table salt. Dress the wound. Some wounds can be left undressed, and others are in areas that benefit from applying an adhesive gauze dressing. Others may require a protective bandage to keep the wound clean and free of debris. Parents can be creative and use other maintenance measures after cleaning, such as loose-fitting shirts, socks, floats, protective boots, etc. Only administer antibiotics, pain relievers, or anti-inflammatory medications prescribed by your veterinarian as directed. Stopping antibiotic treatment prematurely may increase the risk of the infection not clearing or recurring. What not to do when caring for a dog's wound. To promote healing, reduce the risk of infection, and keep your dog comfortable, there are some things you should avoid when caring for wounds. Don't let your dog lick the wound. Don't use hydrogen peroxide or isopropyl alcohol. These can damage the healthy tissue surrounding the wound. Don't let your dog swim or be overly active. How do I know if a wound is healing? An unpleasant odor or discharge of any color is not normal and should be evaluated. The skin should not appear black or grayish, and signs of pain are also concerning. This is also true if your dog's wound has a bandage. If you notice the bandage slipping or becoming moist, if your dog is reluctant to use the affected limb or paw, if your dog is experiencing excessive discomfort from the bandage, if exposed toes, or other areas above or below the bandage, or swelling, or if you notice a leak, visible presence of blood or discharge on the outside of the bandage, your pet should be evaluated immediately. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.